What's up, everybody? It's Steve the Hurricane here with a drink with the Hurricane. And today's topic is going to be, should I track my readmission rates? Cheers. A Drink with the Hurricane, the home care sales and marketing talk show that discusses all things growing your home care business. All right, so this is something that I have been talking about for years. And before I even get into it, because I'm going to share some information from the latest Home Care Pulse report, because the Home Care Pulse is just absolutely incredible. Make sure, if you haven't already done so, you register for the live webinar and be on there live, as I'm going to be giving away prizes worth up to $1,000 to people who are live on that webinar. So you definitely want to make sure you're on it live. It's going to be Thursday, July 23rd at 12 noon Eastern time. And I'm going to be partnering up with Tyler Guthrie from Home Care Pulse, and we're going to talk about the best practices to add revenue to your home care business. Because the home care business is so unique and so special because it has three components. You have sales and marketing, which is your lead generation and conversions. You have your operations and how you run it and how many people you need to run it and so on. And then you also have your caregivers and your recruitment and your retention effort. So we're going to talk about how all three of these components come together to form a triangle and how you can maximize and optimize your business to be as profitable as possible. So do not miss that webinar. Now, back to this topic, and something that I'm going to talk about in greater detail during that webinar is the readmission rates. And the reason why it's so important to track your readmission rates is because that's how healthcare works. Healthcare is all about the statistics. Who's good at taking care of the most amount of people and has the best outcomes? Readmissions are how your hospitals, your nursing homes, your LTECs, your hospice, and your home health are all graded and paid and everything else. Have you ever heard of the Medicare 5-star rating? It's based on their outcomes. Poor readmission rates, 1-star or 2-star. Good readmission rates, 4-star or 5-star, which means you're going to be getting money and everything else. So it all goes hand in hand. Now, why is it important for private duty to have this? Well, the reason why it's important for private duty to have this is because if you want to get referrals from those places, you got to know what your readmission data is so you can strike up a conversation that's intelligent that leads you to be able to create what I train all my clients on, an interdisciplinary team, so that you can take care of the people and keep them home and out of the hospital. Now, Home Care Pulse, I love Home Care Pulse, and let me show you this, what they have on the screen here. So hang on one second. So you see right here on the screen, Home Care Pulse surveyed over 1,000 locations in the United States. And 75% of those locations said, yes, they are tracking readmissions. Now, this is a very high number, as most people, when they come on the services with me, weren't tracking readmissions until we taught them how to do so. So I'm glad to see that the number is 75% versus 25% aren't. But I do not feel that this is an accurate representation of the entire industry. I feel that maybe it's the reason why is because they have a certain number of people who are doing over $1 million in revenue. And the people who are doing over $1 million in revenue, all of them or most of them are tracking their readmission rates. And so that's why the number is so high. But regardless, I'm very happy to see this, as in years past, it was less than 20%. And so this is a good thing to see. Now, going forward, look at what the readmission rate is. So when they look at all the people that they surveyed, the national average, we'll say, is right smack here in the middle at about 3%, which means for every 100 patients that you take on services, 3 of them are going to end up going back to the hospital within 30 days of a discharge. Now, why is it so low when the national average for readmissions is around 17, 18%? Reason why private duty is so much lower is because private duty takes care of what Medicare doesn't. And the number one cause of a readmission is not following the discharge plan properly, which means they're not getting to their physician when they're supposed to. They're not taking their medications when they're supposed to. They're not eating meals like they're supposed to or getting proper nutrition or hydration. They're not doing their physical therapy exercises like they're supposed to. And basically, they're not able to get out of the house and do all the things that they're supposed to do as part of their therapy and rehab to get back on their feet. And so as a result, although Medicare does come in and provide therapy and nursing, it doesn't help with all of the things that I just said. Therefore, the person weakens, they go back to the hospital, they get readmitted, and then it's a penalty to the referral source. What we do and what we can do for you, if you haven't had a coaching session yet, I've been giving those away for a couple of weeks. So I'm going to say call my office or email us at info@homecaremarketing.net and ask for a coaching session. And we can go over how you can create your readmission rate, track it, and then leverage it to get referrals from referral sources that you're not getting business from. This is the hurricane way since 2012. And this is the reason why I've helped so many clients grow their revenue by more than $1 billion, because this works. So if you're not tracking your readmissions, you are missing the boat. So track your readmissions. Make sure you're on this webinar that I'm going to do with Home Care Pulse, and make sure that you get your free coaching session before we stop doing. It's $250 we charge for coaching sessions. We're going to stop doing it real soon because we've reached our quantity. But make sure you get in before we stop doing that, because I want to help you blow away the competition. So there's the Drink with the Hurricane for the week. Be safe. God bless. And I'll talk to you soon.